Hey everyone, it's Marianne from the New York City Organization of Public Service Retirees. I believe this is installment 4 of Debunking Michael Mulgrew's United Federation of Teachers Retired Teacher Chapter RTC from yesterday, November 28th. In this meeting, he answers questions regarding healthcare. Here is yet another retired teacher asking a question that Michael Mulgrew basically gaslights him on.
Hi, Michael. Just a follow-up on the copay thing. My name is Fisher, by the way. Why is it? I mean, I'm very happy that we're not paying copays. I know Emblem's plan was to charge us copays. I know that because the first time I heard about it was at the RTC Standing Healthcare Committee meeting that we've had with you and the CEOs of Emblem back in the summer of 2021. Empire, yeah. Right, Empire, yeah.
And actually, the copays, if I'm understanding the meeting that he's referencing, the Emblem Empire meeting, that was for not senior care, that was for the Alliance plan, not the senior care plan. But at the same time, they were instituting copays in senior care, but the copay that was supposed to be in the Alliance plan, which is the Medicare Advantage, was on visits other than your primary care visit, to my recollection. So they were trying to say it was less to make sure that a copay is to control behavior. If they put a copay on something, it is to prevent you from going somewhere or going to that place often. That's why they put in a network. And if you don't go to these urgent cares, the ones that they want you to go to, these urgent cares would charge you nothing. But if you went to these urgent cares, they would charge you $100. So the normal human would go, I'm not paying $100. I'm going to go to the free place. That's the encouragement. So it's utilization use. And there's a really evil video I have to find and attach to this because it will show you that in our testimony hearing that was done in the hearing that we had in January, I believe it was, Claire Levitt from Labor Relations talks about this really evil way of being able to control how a person uses their health care. So it was a very ugly way of saying that the way that they manipulated you into not going where they didn't want you to go is they made it expensive so you wouldn't go. That's what copays are used for. So the copays that they implemented in senior care was on every single service, visit, procedure, everything. And there had never been a copay there. What they did was they put it on there to make to make it impossible for you to financially afford to stay there, and you would transition into the Medicare Advantage plan, which didn't have them on your primary care visit. And they wanted you to go to the primary care doctor with no copay for just about everything, of course, so that you wouldn't be going to all the specialists and maybe that they could mitigate some of that. That's managing your care. Might cause you delays in getting the proper treatment because they're forcing you based on financial decisions in how you're using your health insurance. And yes, Michael Mulgrew planned that.
You know, you told us then that their plan was to charge us copays starting in January 2022. Right. Yeah. And you pretty much acted like that was just like a done deal.
It's because it was.
And I just wonder, like, what sort of legal advice were you getting? Because, why didn't Strook advise you? No, I'm serious. Strook. Oh, okay. Well, now they're gone and gone.
Well, actually, the division we were moved somewhere else. So that was
okay. So what is he referring to there? That was very funny for those of us that know. So Strook and Strook is a law firm that's been around for like 140 something years. And the main attorney there is the one you hear me talking about. One of the main partners is Alan Klinger. Alan not only represents the United Federation of Teachers, he represents the MLC, he represents sometimes Emblem, he represents other unions. This firm has so many conflicts. Alan Klinger cannot actively do what's in best what's in the best interest of the Municipal Labor Committee as a whole, when he also represents the United Federation of Teachers. There is a conflict there. So what happened to Strzok and Strzok? Well, about over a year ago, about over 100 attorneys decided they couldn't stand working there anymore, and they left. And then more and more started leaving. And then they were having problems meeting their obligations and their pension payments. And what happened? I guess they went bankrupt. After a failed attempts of merging with other firms, basically they folded. And that just recently happened. But the people, because you worry about people are important, right? They started leaving the firm, leaving a very skeleton crew left at Strzok and Strzok, and that's one of those partners is Alan Klinger, that is pretty much the mastermind of all of this evilness here with Michael Mulgrew. And so that those partners, he is saying, went to another firm. So that's what he's talking about when this retired teacher said, well, I guess now they're gone because because the company folded. And again, it shows you that there was a lot of animosity in that firm. If you read the legal blogs, they were not getting along with the partners. They were not being treated well. There were many issues there. So, but that's a whole nother video.
So anyway, apparently, we know that the New York City Organization of Public Service Retirees, for instance, filed a lawsuit to stop those co-pays because, number one, because they were a violation of the city code, according to the lawsuit, and number two, because it was a breach of Emblem's contract with the city.
Correct.
And why are we relying on other grassroots organizations and other groups within the union who are trying, like retiree advocates? Why are we relying on them to protect us by filing these lawsuits? And you haven't. And you have.
Let him talk.
Okay, so when the cost went up to $500 million, cost went up $500 million for the retiree healthcare.
No, they didn't, Michael.
Okay. What had happened at that point, it went to the MLC to make a decision, and they negotiated the co-pays at this point as a stopgap measure, but also said we were going to put out a negotiated acquisition on an MA plan. The plan throughout, the strategy was that in that plan we would remove the co-pays.
No.
Okay, so we needed a stopgap at this moment because the city was saying we're not on the hook for everything forever if this keeps escalating.
Okay, full stop there, Michael. Oh my God, like liar, liar, pants on fire. You were implementing the MA plan and the co-pays at the same time. It was to make senior care painful so that people couldn't afford to stay in it and would move to the Medicare Advantage plan, which had co-pays except on primary care visits. You did that. That wasn't a stopgap measure. And never in the history that we can find by looking through all the data did you ever have a copay imposed that you rolled back. Copays actually increased, and you've been utilizing them for a very long time. It's not a stopgap measure. You used it as a cash infusion. Shame on you.
This amount of cost. Yeah, but everybody thinks it's still an amount. It went up $500 million.
It did not go up $500 million. Okay, so let's talk about that. As I said in another video, in 1997, the senior care rate was $88 a person. $88 a person. Then in this year, about 2022, the rate came in at about $200. It was just like $191 when this litigation started. That's not a lot of money, Michael. And so you're only talking about 183,000 retirees at the time. So if I do, so if I do 183,000 retirees, let's just round it up for you. At, oops, 183,000 times 200. $183,000 retirees times $200 a month times 12 months. Is $439 million. And that's basically what the cost was on the actuary and the comptroller's report at the time the litigation started. 439 million. It hadn't gone up to, it hasn't increased by $500 million. It hadn't. 439 million. And the rate increased from 1997 to 2022 from $88 to $191 isn't increasing tremendously. It's not. So you keep lying. Show me the data. Please drop it below in the comments. Email it to me, retirees@nycretirees.org. I want to see where you're saying Medicare eligible retirees health insurance increased by $500 million, because you're lying.
A better plan that we really want, and then we'll take the co-pays out. And that was the strategy. That's where it was at. Now it's all over the place. So when it's all gets settled in court, we'll figure out again what we believe is the right path for everyone to make sure that they're getting.
Not for retired people, you not.
And stop with all the craziness. Once it got into the retiree system, the co-pays are the easiest ways to solve for increased costs, but they're the wrong way to solve.
So then if it's the wrong way to solve it on the retiree side, why did you impose them? In the litigation, Emblem proved they didn't initiate them. They had the memos that said you told them to do it. You told them to initiate copays. And you also kept increasing copays in the HIP VIP plan, the HIP HMO plan, and the GHI CBP plan. And remember, since the 1992 agreement, all changes to healthcare have to be negotiated with the unions, which meant you're the union, Michael. You agreed to do that. If you didn't like that, why did you keep doing it over all of those years? Why? And as the largest union in the city, in the MLC, with the largest stakeholding vote, you did that. And you just lied to your retired teacher chapter.
A copay to me is a cost share. That's how I look at a copay.
It is.
It's a cost share. So if everybody in the industry is dealing with, oh, I'm getting a 12% increase, we're going to drop, oh, we're going to give you an 8% increase, but we're going to increase the copays. You didn't really get a 4% drop. You just shifted that 4% to copays, which is a cost share. So it's the wrong strategy to use. We first needed to get into place this aggressive negotiating strategy where we can actually stop playing by their rules. The insurance company will I'll give you a better rate. Let's deal with the copay. I don't want to do that.
They didn't do that, Michael. You did.
Make you now agree to things you have never agreed to. And I'm going to do the same things with the hospital. So the whole thing here was to reset the playing field, which is not easy to do. You have to take time to do it. And yeah, people get upset, but it's not like the union's not trying to get us to the better place that we know is going to allow us to keep what we have, and more importantly, to actually probably get us better than we had, because nobody else is going to do it this way.
And what you're trying to do is force people into managed health care. And if it's any indication what you did to Medicare eligible retirees, you're going to start to do that to active workers. Come on, Michael, the writing's on the wall. We can all see it. And the reason why you're telling people that they don't have a choice of healthcare plans, that's wrong too. You don't want them to know, you're insisting with them that there's only one plan, that the judge says there's only one plan, that all they have to have is HIP HMO. You don't want them to know that the judge said they could have choice. Not that the law said that there could, but his interpretation, as I read in the previous video, that the judge interpreted that choice, since it was in the intent of the legislation, that the council in the past had, when they legislated this law, wanted retirees to have a choice of plan. For active workers, what you're saying to them is the reason that you don't want them to know that they could have choice and that they could be forced in just HIP HMO, which is ridiculous because it is a regional plan and it's not available around the country, and that would violate the law too, is because you destroyed the stabilization fund, which paid for the premium difference between HIP HMO and GHI, the plan that like 94% of the people are in. And because there's no stabilization fund to pay the difference in the equalization rate, then it wouldn't be premium free because they would have to pay the difference. They could still have the plan, they would have to pay for it. And so that's why you don't want them to have the plan. It's okay, baby. You could tell them. We all know.
The biggest piece of that contract, you're going to sit for a minute now. The biggest piece of that contract was the committee that gets all the information. Because it wasn't just a committee. We also had a whole list of penalties, massive penalties. When you're dealing with an insurance company, you don't give them $1 million penalty. You give them a $5 million penalty. And we put massive penalties automatic inside of it, equal to HIP. It's not going to be a good end. It's going to be a very bad end. Because HIP is just going to diminish the service. And that's what's going to happen. I don't understand why people don't see that. When you read these lawsuits, you read the findings. City is now only responsible for this. Oh, guess what? We'll make it cheaper. How? We'll diminish the services. That's what's going to happen. And this union is not going to allow that to happen. We're not going to play by the city's rules, OMB's rules, the insurance company rules, or the hospital rules. Screw all of them because they don't care about the workers. We're going to reset this and make it, they're going to play by our rules, and we're going to stop playing by theirs. That's what we're doing. Okay? Here, information. Because it wasn't just a committee. We also had a whole list.
Okay. Do you remember when he just said that they had these massive penalties? Okay, I really need to show you this because millions of dollars, Michael. Oh my God, they're not millions of dollars. If I had a penny for every time you lied, I'd be a rich woman. Okay, so here are your general performance guarantee provisions for this plan, the Medicare Advantage PPO plan. And this is for the Aetna plan, by the way. So Aetna believes that measuring the activities described below are important indicators of how well it services the city. Aetna is confident that plan administration, claim administration, member services provided to the city will meet the city's high standards of performance. And to reinforce the city's confidence in Aetna's ability to administer the program, Aetna is offering the following guarantee areas. So what is the penalty if so the standard would be Aetna guaranteeing members' current treating providers will take the plan. So if they won't take the plan, the penalty is $680,000. That's not massive in a company that's billions and billions and billions of dollars, by the way. That is absolutely ridiculous. And this performance guarantee was from September to December of 2023, my dear. That ID cards would be generated within, I guess it was 10 days or something, 10 business days. If they fail to do that, the penalty is $380,000, not a lot. This is their holding of these in-person and virtual meetings for outreach, $380,000. The call center, the availability of the call center, maintaining an 80% in less than 30 seconds and an abandonment rate, that's people hanging up without getting someone, $76,000. That's not massive, my dear. Healthy home visits. 100% of eligible Medicare Advantage PPO ESA plan members will be offered a healthy home visit. You know what that is? First of all, the penalty is $380,000 if they're not offered that in the first 150 days. But healthy home visits is how they come to your house and they try to upcode you to get more money from Medicare. That's a scam of fraud. That's not them helping you. No other insurance company does that. You don't need that. COVID vaccinations, deploying concierge approach, dedicated customer service, $380,000. Look at these penalties in the right-hand column, Michael. Coordination with FISA, NICAPs, and the city systems. The Aetna will work to enroll people properly, $380,000. The enrollment file being done in 3 business days, $380,000. You're not really here talking to me about the plan not servicing the people into the way that they're supposed to, or the way that they said that they would. Ability to accept paper or telephonic enrollments. Let's see, coordination with OLR, MLC, direct access to dedicated account managers, $230,000. Aetna acknowledging 99% of inquiries and requests to their account team within 24 hours. Not $230,000 penalty that they can't answer our questions. An average evaluation score of getting a 4.0 or higher, $380,000. This is not high, Michael. These are not millions of dollars. Account effectiveness. So here's your $500,000 fee that if they're not scoring a 4.0 or better, what are they going to do? Hey, did we serve you well? Please take this telephone response. Please press 5 if you loved us. Press 1 if you think we suck. And then, tell everyone to press 5. Really? That doesn't really indicate anything. Pharmacy claims. $76,000 penalty. So if you add all of those numbers up, you get $7 million. They would have to do everything wrong to get a $7 million hit. That's ridiculous. That's not going to happen. Member services and satisfaction. Should the program be used more than 50 times, Aetna agrees to a penalty of $770,000. Aetna guarantees members' current treating providers will take the plan that will have demonstrated the ability to educate providers about the Aetna plan. If a member's provider will not take the plan and requires payment upfront at the time of a member's visit, Aetna will pay the cost of services provided during the visit after confirmation that the provider is eligible to pay Medicare, to accept Medicare. So what this is saying is, should the program need to be, that means 50 people have to call and say that their doctor isn't going to be taking the plan, even though they're Medicare eligible. Then and only then, after 50 people get screwed, will the penalty be $770,000. That's ridiculous. You don't have that problem now with Medicare. And our questions get answered immediately. This is absolutely ridiculous. Don't tell us that they pay millions and millions of dollars in fees for not doing what you want. That absolutely doesn't happen.